thanks for joining us for our session today. So my talk, as Prof has mentioned, will be on droopy eyelids. And let's start first by talking about what is ptosis. You might have heard this term before. It's actually the medical name for droopy eyelids. So eyelids can be droopy on both sides, or they can be droopier on one side than the other. This is a picture of a celebrity as well as of one of my patients, and you can see that droopy eyelids can actually affect young as well as older people. It's not to be confused with the term dermatochalasis. So dermatochalasis is actually the excessive overhanging skin from the upper eyelid. So if you look at these pictures, you can see that there's this droopy skin, more prominent temporally, or rather towards the side. We do see this sometimes with ptosis, meaning that the inner eyelid is also droopy at the same time, or it could actually just be a patient having dermatochalasis without any severe ptosis. So what are the issues with droopy eyelids? First of all, patients often complain that they feel that it's very difficult for them to open their eyes. Their eyes feel heavy. They say that there's something weighing down on them. And all day long, because they are fighting against this heavy eyelid, it makes them feel very tired. And of course, the other consideration is cosmesis. So again, patients may feel that their eyes are very droopy, and this may make them look tired and exhausted. It might be something of concern, particularly to people who are frontline facing. Now, patients may also get persistent forehead strain. This is because in order to compensate for the droopy eyelids, they have to persistently raise their eyebrows. So it results in the deep forehead wrinkles, as you can see on the picture on the left, or it may look like there's asymmetry. Look at Sylvester Stallone here. You can see that he's raising one eyebrow much higher than the other. The droopy eyelids may also cause a visual field obstruction. So if you compare the visual field on the right, you can see that the circle is much bigger compared to the visual field on the left, which shows that the patient actually can see a lot better after we tape up their eyelids. And this is the Humphreys visual field, where the image on the left shows the blacked out portion, which is what the patient cannot see, comparing that to the image on the right, where there is much less black area. And this means that after the eyelid is taped up, which is what we aim to achieve after the eyelid surgery, this should actually relieve a large amount of the visual field obstruction superiorly. So now let's talk about what the causes of these droopy eyelids are. First, we need to understand the eyelid anatomy. So right on the top, there's this levator palpebrae muscle. This is the eyelid muscle that is mainly responsible for lifting the eyelid up. And there's also the mullus muscle, which is a secondary muscle that is also helpful in lifting the eyelid. If any of these two muscles are affected, then this results in droopy eyelid. These muscles are connected to the upper tarsal plate, which is something like the backbone structure of the eyelid. Now, the most common cause of droopy eyelid or ptosis is aponeurotic ptosis. This is due to an acquired defect of the levator muscle, and most commonly is due to stretching. This occurs as we get older, or it may occur through trauma. For instance, in patients who frequently rub their eyes, if you have constant itchy eyes, or even in contact lens wearers, because you have to pull the eyelids open to put the contact lens in. This results in overstretching of the muscle over time, and muscle, like a rubber band that keeps getting pulled, will eventually become loose. So one example of involutional ptosis, which is due to stretching of the muscle or weakening over time, or patients can actually be born with it. This is a picture of Forrest Whitaker. He's a very famous Hollywood actor, and he is known to have this left eye ptosis, which he was born with. This is not because the muscle is overstretched, but simply because as a baby, once you're born, the muscle development in the womb was somehow defective, and it's a poorly functioning muscle. It can also be associated with after procedures. So this is somebody who shared on social media about how her eyelid was drooping after she performed had Botox performed. Most likely the Botox medication went erroneously towards the eyelid muscle, resulting in weakening of this muscle, and therefore the patient has developed ptosis. Also, rumor has it that after some kind of eyelid surgery, Paris Hilton then developed a left droopy eyelid. So eyelid surgery can also result in a droopy eyelid. Of course, she has had it corrected since. And finally, we have a patient here who is one of my patients at Eye Center. She has unfortunately multiple eye conditions and had to go from different eye surgeries. After multiple rounds of eye surgeries, the eyelid muscle was weakened and she ended up having a droopy left eyelid. Okay, next, we can have droopy eyelid also due to the poor innervation of the muscle from the nerve. You might have heard of conditions such as Bell's palsy or facial nerve palsy. So Justin Bieber, whom some of your daughters may know, was recently afflicted with this and posted these pictures of himself to share. In such a case, it is not just the eyelid that is weak, but also entire half of the face. So you can see he's trying to demonstrate that he's smiling here, but he's unable to lift up his mouth on the right side of his face. And consequently, he cannot close his eye in the next picture. And he will also have a droopy eyelid when he opens both eyes. Another nerve that is very important is the third nerve. This is the nerve that is involved in innervating one of the muscles for our eyelid as well. So unlike the other causes of ptosis that we have mentioned previously, this is a more sinister cause of ptosis because it could be caused by conditions that may be potentially life-threatening, such as stroke, brain blood vessel aneurysms, or tumors. It doesn't present with just an isolated droopy eyelid most of the time. Patients may actually suffer from double vision because this nerve also innervates the movement of the eyelids. Next, there can be a condition known as myasthenia gravis in which the innervation to the eyes are also affected. So this condition may affect just the eyelids, just the eyes, or it may affect the whole body. Generally speaking, it's weakening of all the muscles, so the patient may have droopy eyelids, may even have double vision, or if the rest of the body is affected, they might be very tired, they might find it difficult climbing stairs, lifting heavy things, and in the more serious conditions, it might also result in difficulty breathing, speaking, or swallowing. So this is also, again, a more sinister cause of droopy eyelid. And another innervation pathway is through the sympathetic pathway. So this is when the nerve supply to the secondary muscle that I mentioned earlier, the Muller's muscle, is affected. And this also may be life-threatening. If you see from the picture, it results in a more milder form of a droopy eyelid. But again, it will have to be diagnosed by seeing an eye doctor. So if you ever develop a sudden onset of droopy eyelid, especially on one side, it would be prudent to see a doctor to get this assessed. All right, so let's talk about how we can actually prevent the droopy eyelids from worsening. So first of all, most important thing is to be very gentle with your eyelids. If you can treat any conditions that might predispose your eyes to being itchy or uncomfortable that can cause you to rub your eyes, that would be best. For instance, if you are known to have some kind of allergic eye disease or dirty and inflamed eyelids, then we do have methods, medications, as well as eyelid cleansers to try to reduce this. To minimize the eye rubbing is the aim because this will help to reduce the chances of the eye muscle being stretched. So similarly, if you are a contact lens user, if you could minimize it, give your eyes a break, for instance, on the weekends, that will help to minimize your chance of droopy eyelids, but also helps to minimize the dry eyes and any development of allergy. Finally, try not to pull your eyelids. It is not actually recommended to perform frequent eyelid massages in that sense, because I have seen patients who demonstrate active pulling of the eyelid, which they claim is a form of massage. This would actually stretch out your eyelid muscles and cause everything to deform. However, if you already have droopy eyelids due to aging or any other causes, what can be done surgically for it? The form of surgery we have is called Ptosis surgery if it's for the droopy eyelid, or Blepharoplasty if we are also dealing with the dermatochalasis alone. And the aims of this surgery is to help to relieve the droopiness as well as remove any excess skin that there might be. At the same time, once the eyelid is no longer droopy, the hope is that you don't feel so tired, you do not feel the heaviness, and you do not need to constantly raise your eyebrows up to try to compensate for the droopiness. This can relieve any form of strain or headache that you might be suffering from around the forehead region due to this constant raising of the brows. If you recall the visual field slides that I showed earlier, we also hope to improve the superior visual field. Of note though, this surgery will not actually improve your vision in terms of the visual acuity. This is how sharp or how small the objects you might see. That will be more towards the cataract surgery, which Dr. Daniel was talking about earlier. And of course, the final gain of cosmesis is an additional plus. So this is a day surgery. It's done under local anesthesia and not general anesthesia, meaning that you will be awake. You can hear us talking to you. And briefly, I'll just go through the surgery. So first, if you look at step 1, we would like to remove the excess skin. In step 2, we open up and go down to look for that weakened muscle. In step 3, we then release it from the tarsal plate. And in step 4, we then suture the muscle down again to the tarsal plate to achieve a desired height and desired contour of the eyelid. And the aim is to relieve the droopiness and at least lift the eyelid higher than it was before surgery. So these are some examples of my patients. This one patient who underwent a left eye ptosis repair. So you can see that her left eyelid was very droopy before the surgery. There's this picture on the top. And when you compare it to the picture at the bottom now, her eyelid is much lifted up. You can actually see the cornea and the pupil. Of course, we can do 2 eyes ptosis repair at the same time. Again, the picture on top is my patient before we performed the surgery on her. And below, you can see now she looks more rejuvenated. The eyes are lifted up and she can see better superiorly. Another patient of mine who had a more severe ptosis. Again, we operated on both sides. You can see that the right eye was much droopier than the left eye before the surgery. Now we have elevated both sides adequately. And again, there can be blepharoplasty, which is the surgery where we only remove the excessive skin. We do not need to relieve the ptosis. So for this patient, I only remove the excess skin that's overhanging, which you can see on the top picture. I didn't actually have to open up to repair the muscle. And just by relieving the excess skin, you can now see his double eyelid crease and the excess skin is no longer overhanging and blocking his vision. This is a younger patient who had a very mild ptosis on her left eyelid. So she underwent surgery and we repaired the left eyelid. However, of note, this would be considered a cosmetic surgery repair because it's very mild and probably did not hit the criteria set out by MOH to qualify as a non-cosmetic surgery. All right, so for brow lift, this is also another form of surgery to relieve the ptosis, especially if your eyebrows are droopy and hang downwards. So there are 2 forms. We can either perform a direct brow lift, which is shown over here. A simple illustration is that we remove the excess skin over the eyebrow to lift up the eyebrows and suture it down to the correct position. It then helps to relieve the droopiness that's also below. Alternatively, this can also be done endoscopically, but this will be under general anesthesia because we tunnel in from incisions which are hidden near to or in the hairline. So this is an example of one of my patients who we did an external brow lift for. You can see that his eyelid skin is overhanging on the side. Her eyebrow is very low and close to her eyes. And just by lifting up at the eyebrow area where you can still see the stitches are now, we actually help to relieve the blockage. And you can see that the skin is no longer drooping over and you can see more of her cornea. So what are the risks of surgery? As with any surgery, the risk can include pain, bleeding, and infection. The eyelids will definitely be swollen after surgery. I do have to emphasize on this point because The eyelids are one of the thinnest structures in the body. And if after any form of surgery or trauma, there will be quite severe swelling and bruising. There can be scarring after the surgery, especially for external brow lift, because we have to have an incision near the eyebrows. And unfortunately, as females and as Asians, we don't have very, very thick eyebrows, which we can hide the scars under. Of course, there are ways about it, such as if you are open for tattooing your eyebrows, we can also hide the scar under the tattoo. And when we perform the surgery on the operating theatre, we will of course try to achieve as much symmetry as we can. However, due to variability of bleeding, swelling, and recovery after the surgery, you might find that the eyelids are not as symmetrical as you wish for, and we will typically perform an adjustment in the clinic at about the 1 week mark. Finally, after we lift up the eyelids, there will be difficulty closing the eyes. As you can imagine, if we have pulled it upwards, now when you attempt to close, there may be a little bit of a gap, resulting in dry eyes. So what can you expect for the surgery? Before the surgery, we will perform extensive assessments. It is not a simple surgery where you come one time, see us, and then we immediately list you for surgery. We will want to do a lot of measurements, send you for lots of tests. And if you're on any blood thinner medications, we will need to seek approval from your doctors, whether it's the cardiologist or neurologist, for stopping the blood thinner medication. During the surgery, if the patients are usually sedated but not fully asleep. This is because we actually need you to open the eyes so that we can assess for the height as well as the shape of the eyelid. In the surgery, we may also get patients to sit up so that we can see how nice or how droopy the eyelids are during the surgery itself. After the surgery, as I have mentioned before, we really do expect a lot of swelling and bruising. This is especially so if you are on blood thinner medications. And for example, this is one of our patients. This kind of swelling and bruising is completely expected and not to worry if you do experience it. We then perform the adjustment at about 1 week mark and remove the stitches at about 2 weeks mark. The swelling may persist for at least a month, and some patients take longer to clear the swelling, even up to 3 months, and in rare cases may even take up to 6 months for it to be completely normal. However, this sounds scary, but not to worry. Usually by 1 month, you look fine, you can go out and about. Now, my final slide is about who should we have to perform our surgery. The only remark I'll make is that please seek for a qualified surgeon. There are practitioners out there who are actually non-medical, meaning they are not doctors. Some label themselves as beauticians, but they still do perform some of these procedures which are actually not licensed by the Singapore Medical Council. So if patients who choose to go to these practitioners will do so at their own risk. We have some cases. This is one of my patients who went and had a beautician do an lower eyelid surgery as well as an attempt at external brow lift. Well, I think they did a good job in lifting everything, but the downside is they also removed all of her eyebrows. So once that is done, unfortunately, there's nothing we can do to make the eyebrows come back. And there are other patients who had not so optimal outcomes. It's difficult for us to correct or deal with these deformities after the deed has been done. Okay, thank you, everybody.